The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
If you're a man over 50, you have 1 in 2 chances of having it. If you're in your 80s, you have a 90% chance of having it. It's a prostate condition called BPH, benign prostatic hyperplasia, and it can make it very difficult to go far from a men's room. But there's help and there's hope. Meet the doctors, discuss the treatments, and meet the patients dealing with BPH every day. Today on this special edition of Today's Health. This program is brought to you in part by an educational grant from Pfizer U.S. Pharmaceuticals Group.
When it comes to the prostate gland, most people are simply unaware of what can go wrong with it. For instance, did you ever have the feeling that if you didn't make it to the bathroom right away, you were going to have an accident? For some men, it's a persistent problem, and it could be a warning sign that they have a problem with their prostate gland. It's called benign prostatic hyperplasia, or BPH. Hello, I'm Faith Daniels, and this is Today's Health. In this special edition, we're going to examine the most common disease affecting the prostate, BPH.
The prostate gland. It's not exactly the topic of light conversation. So many people who may have heard of this gland have no idea of what it is or what it does. It's important for men, especially those in their 40s, to understand how important this gland is and how it can affect them.
The prostate gland is a gland that sits at the base of the bladder, and basically its important function is a sexual role in which it contributes about 1/3 of the seminal fluid that's involved in an ejaculate.
The prostate in a baby boy is about the size of an almond and remains that way through childhood. When the child hits puberty, the gland nearly doubles in size and then its growth slows. Normally, the prostate goes pretty much unnoticed, but in some men, mostly those over 50, the prostate can be affected by several diseases. Prostatitis is an inflamed prostate caused by an infection. It can affect men of all ages, and it does not affect your risk of getting any other prostate disease. By far, the most common of all prostate diseases is benign prostatic hyperplasia.
The benign prostatic hyperplasia, or BPH, or prostatic enlargement, produces the type of symptoms such as frequency, getting up at night to urinate at a slow stream. But sometimes the prostate gland can grow to such a size that one cannot empty their bladder well.
Prostate cancer is another disease that could affect this organ. It's the most common cancer in men. About 240,000 cases are diagnosed each year.
Prostate cancer is a malignancy of the prostate that starts at older age, and it affects all age category for starting age 40 up to 90s.
If detected early, it's very treatable, and the survival rate is 92%.
Early detection is important because that's when the disease is most treatable. With early detection, there is the good likelihood that a man can be cured of his prostate cancer and live a normal, healthy life.
The key to successful treatment for all prostate diseases is early detection. That's why it's so important for men to get a yearly rectal examination. Now, the procedure can be uncomfortable, but it's quick and relatively painless. If your doctor spots something early, it can mean a lot more options and a lot less risk.
It's human nature that men are often embarrassed about urinary problems. Unfortunately, though, the shame often prevents them from seeking treatment for benign prostatic hyperplasia. Hopefully, with a greater understanding of the disease, more men will be less reluctant to seek help.
If you're a man approaching your 50s, then it's a good idea to understand the disease of the prostate called benign prostatic hyperplasia, or BPH. The condition occurs in middle-aged men when the prostate gland begins to grow and squeezes down on the urethra. The condition affects nearly half of all men over 50 and about 90% of men over 80. When you consider that about 25% of all cases require treatment, it makes BPH a very undertreated condition.
BPH is undertreated because it is frequently underdiagnosed. Men frequently accept frequent urination both day and night, frequently accept urgency of urination, thinking it is part of the normal aging process and does not need to be treated.
Between 60 and 65, I started noticing I was always looking for bathrooms before I started out on any kind of a trip. Well, I had nocturia, which means, frequency during the night. But I have to get out of bed 5 times sometimes. It sort of screws up your sleep. And sometimes I just find I can't get back to sleep, so I suffer from chronic insomnia.
BPH is not normally a life-threatening disease, but it can cause a great deal of discomfort.
When the urine is completely blocked off, serious problems such as serious damage can occur. One, to the bladder because it's being stretched to a dangerous level, and 2, it can also back up to the kidneys and hurt your kidneys as well.
And we were on I-95, and I said, oh, geez, I think I'm going to have to go. And by the time I could pull off to the side of the road, and I had a urinal in the car, too late. I had wet myself.
There are multiple treatments for BPH. Our goal in treatment, when we decide treatment is needed, is to increase quality of life for the man so afflicted, and also to prevent any complications due to the BPH. It should be understood that BPH and prostatic cancer are 2 separate diseases. If a man has BPH, this neither increases nor decreases his chances of having prostate cancer.
The irritating and obstructive symptoms of BPH are very common in men over 50, and too often they can detract from someone's quality of life. And that's unfortunate, because the condition can be treated, but only if a man is willing to seek medical help.
The symptoms of BPH can invade your lifestyle, but there are treatments to help relieve them. What can be done to make this condition less intrusive? There's more help and hope than ever before. Find out why when we return on Today's Health.
Doctors have several strategies when it comes to treating a patient for benign prostatic hyperplasia. Depending on the severity and the progression of the disease, treatment could include surgery or prescription medications, but in most cases, the chosen option is watchful waiting.
You'll have to wait and see. You've probably heard that saying before, and it could be very easily applied to the most common treatment strategy for BPH. In most cases, the doctor's first treatment is no treatment. It's a strategy called watchful waiting.
Watchful waiting is really a very passive way to approach enlargement of the prostate. If someone has symptoms but does not believe that those symptoms are sufficiently troublesome as to justify the potential side effects of any of the treatments, then they can simply be watched.
Roughly about 3 years ago, I found it a little bit more difficult to void. And as time went on, it became harder and harder. It took longer and longer. And then one of the problems is that I never can really void completely. I can't really empty my bladder. I have fear of going for surgery, having gone through a number of other critical surgical procedures.
The watchful waiting strategy is different than doing nothing about your symptoms. The important thing to remember about this treatment option is that the patient periodically visits his doctor for an examination. This is a proactive strategy to monitor the condition and possibly start treatment if it progresses or complications arise.
As long as I can live with it, I just stay with it and watch and wait.
I think it's important that a person be known to a doctor and be followed carefully, because there are some risks involved with not treating, and those risks should be monitored for.
the appreciation of just the everyday things in life which we take for granted. The sunshine, the greenness of the grass, the leaves, nature, just getting up in the morning and seeing that daylight. It gives us a new appreciation of life that we take for granted.
Sometimes the best course of action is to take no action. Watchful waiting is a common treatment strategy which allows the patient to keep an eye on his condition, yet avoid surgery and medications until those medications and treatments become necessary.
Among other things, the symptoms of BPH can make a man feel as though he better not stray too far from a bathroom. When it becomes too much of a restriction on a normally active lifestyle, there are several treatment strategies. One of the least invasive options is medication.
When a doctor and patient decide that it's time to intervene and start treatments for the symptoms of BPH, they have several options, which include medication and surgery. For patients who would prefer to avoid surgery, there are several prescription drugs which can help to alleviate their symptoms. One category is called the alpha blockers. Alpha blockers, like Cardura, developed by Pfizer Laboratories, relax the smooth muscle of the bladder neck and prostate. This relaxation can help relieve pressure on the urethra and help improve flow rates.
Alpha blockers, the rationale for using them is that a portion of the blockage of the prostate is secondary not to just having a big piece of prostate sitting underneath your bladder, but to smooth muscle tone, which compresses the urinary channel. These are under alpha receptor control. By inhibiting the alpha receptors by an antagonist, an alpha blocker, you release the smooth muscle tone, you release the blockage, and therefore you release the urine, and it comes out easier, the symptoms improve, and the quality of life can improve.
The symptoms I had included frequent urination, getting up at night from sleep, getting out of bed, and having to go to the bathroom. Well, since I've been taking the medication, I noticed that my flow of urine is much stronger. I don't have to go to the bathroom as frequently as I used to, and I don't have to get up during the night.
Another type of medication available that acts on the conversion of testosterone and reduces the size of the prostate is finasteride. This drug is taken once a day and requires about 6 months for maximal effectiveness. The side effects can be sexually related and could include decreased libido, ejaculatory dysfunction, and impotence.
I don't have prostate cancer. I just have the problem of an enlarged prostate and frequent urination and getting up during the night and having to rush to the bathroom during the day when I was out sometime, and now with the medication it's controlled all that.
If you have benign prostatic hyperplasia, you don't have to have surgery. You have options. Medications are available to help to relieve your symptoms. The first step to coping with this disease, however, is getting to your doctor.
When medication fails to bring relief, surgery can be the next alternative. Why does it work? What are the drawbacks? Are there any other options? Stay with us. We'll be right back on Today's Health.
It's very important that all men over 40 get an examination of their prostate once a year. Early detection is the key to treating almost all diseases that affect the prostate gland. There are many treatment options available, and for some patients, a surgical procedure can help restore their normal lifestyle.
If you're coping with BPH, surgery to alleviate the symptoms is probably one of the options you're considering. The primary surgical procedure is called transurethral resection of the prostate, and doctors perform over 400,000 of these procedures every year. The annual bill for these surgeries, lost days of work, and hospital stays exceeds $2 billion annually.
After gallbladder surgery, I could not void at all, and they had put a catheter back in me, and I knew something else was wrong, but I knew I had an enlarged prostate, but I didn't know it was that large. Temperature's nice and warm, just like the sun. Well, right now the medication didn't do a whole lot for me. That's why I went to surgery. It was a long term with medication. For I guess some people work straight on, but other people it doesn't. And I'm one of them. So I went to surgery.
Surgery is used in some individuals who have symptomatic BPH because either they are not candidates for medical therapy or they do not get the symptomatic improvement from the medical therapy and need another form of treatment.
The transurethral resection of the prostate is the classical endoscopic approach to relief of prostatic obstruction. An instrument is passed under anesthesia through the penis, through the urethra, into the bladder and prostate area. A small electrical cutting loop under control is used to move back and forth through the tissue and remove chips or slices of the obstructing prostatic tissue in this area.
Other innovative procedures that are being used to relieve the symptoms of BPH include balloon dilation, lasers, and heat.
Dr. Skinner, he's been with me all the way. After surgery, he came in. He looked me right in the eye. He says, "Dave, everything's fine." And I looked at him, I says, "I hope so."
Post-operatively, Mr. Sturgeon went home on post-op day 1. He tolerated the surgery without any difficulties. His Foley catheter was removed on post-op day 2, and since that time he's been voiding with an excellent urinary stream. He has excellent urinary control with no urinary incontinence and has a minimal post-void residual by ultrasound of the bladder.
Most of us don't want to be on medication or would prefer to avoid surgery. But when the symptoms of BPH become an intrusion on your life, those options may become necessary. Fortunately, there are many ways to help patients with BPH, and the strategy chosen can be a joint decision between the patient and the doctor.
If you're on the internet already or thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at www.vstar.com. Statistics, symptoms, and treatments really don't tell you the entire story about how a disease can affect a life. The true impact of BPH can only be fully understood by hearing from someone who has it and taking a closer look at how this disease that impacts millions affects one individual.
What's it like to be living with BPH? The clinical descriptions of the symptoms and treatments can often overshadow the human dimension to this disease.
About 4 years ago, I had a problem. I couldn't urinate. It just built up over about a week. And it really scared me. I'd drink 3 or 4 cups of coffee, and I said, I've got to see a doctor, and I got to see one quick.
Have a seat up there.
Up here?
Yeah. How are things been going today? The treatment regimen for BPH is generally a long discussion with the patient and his partner. We try to present all the options: watchful waiting, medical treatment, or surgery. And depending on the severity of their symptoms and their personal preference, we choose a treatment for them.
The doctor had told me that he would put me on medicine for 6 months. If it didn't shrink my prostate or whatever it has to do to it within 6 months, I would have to go in for laser surgery. My words were to Dr. Kester was, I'd rather not take a lot of medicine if I can help it. Let's get the show on the road, do the laser surgery, and get it over with, because I've got to get back to work. And that's exactly what he did.
The laser surgery worked really well for approximately 1 year, and then his symptoms came back.
When I was on the road, I felt like that I couldn't urinate. My bladder was full, and it's not a pleasant feeling at all. I knew I had to do something. Get to a doctor.
I want to have a quick examination of you. Can you lie back for me, please? Everything seems fine here. At that point, and again discussed with him all the different treatment options, Cardura, one of the alpha blocking agents, was now available. He decided to try it, and it worked extremely well for him.
I've been on Cardura for approximately 3 years. I take it faithfully every day, about 3, 4 o'clock in the afternoon. When I first took it, it took approximately a day to a day and a half before I started urinating back to normal again.
Now that I know he's on the Cardura and he's taking it, there's a big, big difference. He's back to normal.
The future for John, he will continue to be examined and evaluated while he's on the therapy, especially to make sure prostate cancer doesn't develop as he gets older. But I suspect for many years to come, the Cardura will continue to work well for him because it's worked well so far.
Any disease can become a tyrant. For people with BPH, their symptoms can restrict them to a very short distance from the nearest bathroom. It can keep them up at night and groggy during the day. If you're experiencing any of the symptoms of BPH, it's important to get to a doctor. They can be indicative of more serious diseases. And if you have BPH, you can get relief. I'm Faith Daniels. For more information on the topic we covered on the show today, log on to our website at www.vstar.com and join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.